the whole purpose of my talk is to kind of just introduce everyone to what is involved in a Gamma knife treatment, what it's used for, and what a patient would experience throughout the day. So this is a one-day procedure. We deliver a high enough dose that we ablate what we're targeting or what we're trying to treat. So the day starts out with basically checking into our department. We pre-medicate patients with typically a opiate such as Dilaudid or morphine, a benzodiazepine such as Valium or Xanax, to help patients relax. Obviously, there's a lot of anxiety involved in something that's unfamiliar. We place a head frame. This head frame is secured by our neurosurgeons. It involves placing 2 pins in the front and 2 pins in the back that you don't see. That they're kind of here and here. And they're basically small screws or small pins that are secured to the skull. And this places the head frame in a position that really moves relative to the head. So the head does not move without the head frame, and the head frame does not move without the head. This is a fixed device. And again, once the head frame is placed, patients are pretty comfortable. This is not something that's uncomfortable for patients. We do it with local anesthesia. We place basically lidocaine, which is what, if you've ever had stitches placed, they kind of inject you, numb the area, and we use the exact same thing. We place the head frame, and once the head frame is on, patients really don't have any pain associated with this, believe it or not. Patients are, relaxing. They're relaxing with their family. It looks kind of funny, but patients will tell me the worst complaint they have is they might feel, they obviously feel something a little squeezing on the head, but it's not a headache. It's just they know it's there. We'll skip that for the purposes of time. So after the head frame is placed, one of the unique issues with Gamma knife is that the actual planning of how we target these lesions is with the MRI itself. And I think, Dr. Weiss had mentioned that, CT scans are one way of looking at the brain, but the more accurate and more specific way of looking at the brain is an MRI. So we, in other radiosurgery devices, they actually have to do a CAT scan, and they try to merge that CAT scan with an MRI. So there potentially could be some level of inaccuracy in trying to merge the two, and that includes patients who are treated on CyberKnife. The Gamma knife does all of its treatment planning with whatever imaging device you use. So we don't need to do any type of CT MRI fusions. We actually can plan and target specifically on an MRI. If patients can't have MRIs because of defibrillators or pacemakers, we can also do it on CAT scans. We use angiograms in vascular malformations as well, and any other type of imaging device could be fused with the MRI. Once the MRI is done, and again, the MRI is done with the head frame in place, so this is all happening on that day. So typically, patients will have the head frames placed at 7:30. Patients will have their MRIs done started at around 8 o'clock, be done by about 9. And then patients are brought down to a holding area where they relax with their family. They watch TV, they have conversations, read books, whatever they want to do. And during that period of time behind the curtains, myself, Dr. Weiss, physicists will be in process of planning these treatments. And again, these are pinpoint treatments. So we are targeting this lesion with no surrounding normal tissues around it. Our purpose is to treat the lesion and the lesion alone and not affect any other tissue nearby. And there's no other device out there that can achieve this and not affect the normal brain as well as Gamma knife. So the dose fall off, the ability for the radiation to deliver a high dose to the tumor and have the dose fall off to nothing nearby is unsurpassed. Once we're happy with the treatment plan of how this dose is delivered, once we look at those pretty pictures and say that the radiation dose is covering the lesion and nothing else, and we're sparing the tissue surrounding the area, then we bring the patient into the actual Gamma knife unit. And so that head frame, you can kind of see that ring and the pins that are secured are secured to our treatment table. So once we're secured onto the treatment table, the head and the frame cannot move. And this is important, obviously. We're trying to treat this lesion with sub-millimeter accuracy. We're trying to treat this lesion with less than a millimeter, 0.2 millimeters as we described, accuracy. So we can't have patients moving their heads. We can't have any type of mobility whatsoever because we want to target this lesion and this lesion alone. And so patients are secured to the head, secured to the table, so there's no movement whatsoever. This helmet represents 201 collimators, or small little holes. Radiation is allowed to fall through those holes, and these helmets come in different sizes. They come in 4mm sizes, they come in 18mm sizes, depending on the size of the lesion, and we may use several different head frames or collimators on a single patient for a single lesion. And again, 201 holes allow for 201 sources to deliver radiation therapy to a pinpoint site. And the purpose of this head frame and this whole contraption is to move the head in position to put the tumor or the lesion that we're trying to treat in the center of that focus, to put that tumor right in that position. And again, patients are pretty comfortable. Obviously, there's not really any discomfort associated with this. Believe it or not, with this head frame on, patients actually fall asleep. They feel like they're lying on a pillow.